This is the presentation on the physical examination. All physicals include three parts. The health history, obviously finding out what the patient has to say that brought them there and other information that would be relevant to that. Then the physician or the provider will perform a physical exam. They will examine the patient to collect information. And then lastly, there are laboratory and diagnostic tests. Here again, that information, along with the physical exam and history, can be used to find out what the patient's problem is and hopefully to find a therapy that can be used to help out. Some terms that are used. With the word diagnosis, we use the term final diagnosis, meaning that after all is collected up, this is what the physician and the provider has come to the conclusion is the patient's problem. A clinical diagnosis, we might use that term if it has not been decided upon, but it will be used, it may be used in certain situations. And although in outpatient coding, you would never use a clinical diagnosis, you will only use the symptoms. On the other hand, a differential diagnosis, we use that term when perhaps we have to decide, or the provider has to decide between some closely related diagnoses that have similar signs and symptoms. Prognosis is the probable cause and outcome, and then the risk factor are behavioral and physical states that increases the probability that an individual will develop the particular condition. Obviously, it may be something as a part of their lifestyle, or it may be other medications that they're taking or other conditions that they have that would, here again, make it more likely that they might get the one that this is looking at. Acute versus chronic illness. Acute generally has a rapid onset. It's got rather or more severe, if you want to call it, symptoms, and then it will only last a short period of time. On the other hand, a chronic illness may last for a longer time, or a lot of times it comes and it goes, it quiets down for a while and it comes back, but it is generally always there. A therapeutic procedure makes sense. It's a treatment. And here again, this treatment can eliminate or modify a condition, or it can promote recovery. We use the term diagnostic procedure when we are doing a procedure that is gathering more information that we can use for the diagnosis. And we had mentioned about laboratory testing before. You might be collecting specimens, you might be running point of care testing, and here again, these results are used in diagnosis. And today there are so many out there, and they're so relevant to what the provider does. The medical assistant's job is to have the exam room prepared. We want to have it, I would call it, attractive, meaning comfortable and suitable for a patient. Then it must be also well designed and kept up so that the physician can work well in it. So obviously clutter-free, well-lit and ventilated. We should never have trash or biohazard accumulating there. They should be removed periodically. We do want ample supplies, so when the provider goes to do something, the supplies are right there. And there will be some orderly storage, and obviously these supplies are cleaned and prepared as needed. Back to the patient again, comfortable temperature. Here again, maybe you'll have some blanket or something, because cool temperatures on the bed are generally are healthy than very warm ones. Obviously, cleanliness is important all the way around. The hard surfaces are always disinfected. There's no reason for dust accumulation. And we always think here again on the patient's comfort that the doors would be closed, for their privacy. It is your job also with patient preparation. We know that patient identity is very important, because certainly we don't want to associate anything with the wrong person, that something might be done that this information is not theirs. So you will escort the patient to the exam room. Obviously, you would greet them first. Now, you may share more information as you go. You may talk more to them as you go to the exam room. Here again, depending on the process and, thinking a little bit about HIPAA. But you will always be friendly and supportive. The medical assistant will assess vital signs. You've done those before. You will re-practice them here and be reassessed on them during the physical comp. And then we will work on the anthropometric, the measurements. If you need to instruct the patient on disrobing, please be very specific so they know exactly what to do, that they don't feel uncomfortable and, feel that they've done something incorrectly. If they need a urine sample, it's best to know that up front so that, here again, that can be collected, because sometimes it's good to have them empty their bladder before certain testing, because, here again, for their comfort. It may be your job to have the medical record available for the physician. And here again, if the patient needs to get on the exam table, that very well may be your job to help them there. In measuring height and weight, the examination term is called mensuration. So that's where collecting measurements. A change in height is important in children because we're looking at their growth. And in adults, actually, we're looking at decrease in height. Obviously, there is some change in bone with aging, and obviously looking at the disease called osteoporosis. A change in weight is important as well. An unexplained one could be a sign of illness. If someone is on diet therapy, it's really important because we want to note, did they gain, did they lose? Prenatal patient, here again, it may be some assessment of fetal development, and obviously proper weight gain, but not too much, is important for the mother's health. And in children, here again, it is looking at the growth pattern. The basal metabolic rate, the BMI, is a statistic on comparing height and weight. I think was a few years ago, it was more popular, but it still is collected. It may be necessary in certain times. I think, it's not always the perfect measurement for thinking about perfection of person's size. But nonetheless, I will expect you to know the formula. And it is weight in pounds times 703 divided by the patient's height in inches. And then that entire number is divided by the height in inches again. So in figuring this problem, you will take 703 and divide that by the patient's height in inches. That number that you get, you'll multiply times the patient's weight in pounds, and then that number that you get, you'll divide by the height in inches again. Today we use a lot of charts or tables. You'll find them online. There is one in your textbook because you will use that one on some exercises in your assignment. Position and draping is very important. Obviously, the position of the patient, we want it in the best one so that the provider can access what body parts need to be examined. And then the draping, it's for modesty and for comfort and warmth. We'll have a paper or a cloth drape, sort of like a large square or rectangular, and this will be placed over the patient. So between that and their gown, here again, you want to keep them covered as much as possible. Now, obviously, some parts will need to be exposed for parts of exams, but the patient should be covered as much as they can when nothing is needed to be exposed. So it is your job to assist the patient. Here again, if there is an embarrassing or uncomfortable, like knee, chest, lithotomy, dorsal recumbent, you get the person in there at the last minute so that the physician can do the exam, and then you can help them out of it right away. And as we said, it might be your job to help the person on the exam table. It's your job to help them off. And as all these changes are positions may occur, it is your job here again to keep that drape over them. And this will be obviously part of the physical comp. The positions that we generally use are listed here in the following slide. The sitting or Fowler's. That's obviously the patient is sitting up, their buttocks and thighs are on the table. This is a good position to examine head, neck, chest, upper extremities, and to take the vital signs. Now, here's a tricky part. If the person is leans back at a 45-degree angle, and generally you can bring your table up for that support. This may be called Fowler's 2 or semi-Fowler's, depending on who you read, where some places will say sitting as, sort of the 90-degree angle of the back. Fowler's is the 45. Other places will say Fowler's at the 90 and semi-Fowler's at the 45. Here again, if you're using that terminology, you will just have to get it clarified for that instance. If the person is lying on their back, that's a supine position. Way to examine head, chest, abdomen, examine extremities, breast exam. On the other hand, if we have to get the person to turn over so they are lying on their stomach, there is a typo here. This is a good way then to examine the back, and if they need to, assess the hip joint. The dorsal recumbent is a position where the patient is lying on the back, but the knees are bent and the feet are flat on the table. So good position for vaginal and rectal exams or catheter insertion. It's also good for some people that don't like to lie flat on their back. It makes them feel a little better. Lithotomy position is lying on the back, the legs are bent, and the feet are in the stirrups. This is specifically or most frequently used for the pelvic and vaginal exams, but it can be used for some rectal exams, generally as a part of the pelvic exam. The Sims position, or left lateral position, the patient rolls onto their side, and they're on their left side, and their right leg is bent. This is a good position for the vaginal and rectal exams, for rectal temp in an adult, to use a flexible sigmoidoscopy, or to use to give an enema. And the knee chest, the knees and elbows are on the table. It's a table that sort of folds up, butts up in the air. It's for a rectal exam and the proctoscopic exam. A lot of times, like I said, the physicians that do these on the male often have a table that sort of folds into this position. And this certainly, as we mentioned, is one that the patient would put in the last minute just before the exam, and as soon as it's finished, you take it back into, getting out of that position. Assessment of the patient. So here again, it depends on the purpose of the exam and the condition of the patient. Generally, the physician begins at the head and moves towards the feet. Here again, a complete physical will look at all body parts. A more focused exam will just look at some particular areas. But generally, it starts at the top and goes to the bottom. And the assessment terms will be discussed here. Inspection, obviously, we're observing the patient. We can see color. Speech, that's more hearing, but yet that is sort of, noticing, if we want to call it that. We'll see deformity, skin conditions, body contour, symmetry, orientation to surroundings, body movement, and anxiety. Palpation, we're using the sense of touch. So this is the placement and size of organs, palpating masses, the existence of pain. If we press and see results, we can pick up swelling and tenderness, obviously with this pressure, because we're observing the patient's reaction. It is considered light if the depth is about a half an inch. It is considered deep when often we would use two hands and we would palpate the tissue between the two. One is above and one is below. Percussion is a tapping with the finger and listening. Often we put one hand down and we tap with the other on top of it. And here again, listening to the sound that this makes. This could determine size, density, or location of organs. Auscultation is defined as listening with a stethoscope to the body sounds. We listen to heart and lungs, and when you assess the blood pressure, you use this, and pressure is incorrectly spelled here. Obviously, you want a warm and clean chest piece so that we're not dragging germs along and making the patient jump as we do this. And then it will be your job to assist the physician as needed. Some of the things that you may do would be to help the patient, as we mentioned before, when they're changing positions, to keep, and if they're using a drape, to keep that, keep their privacy at all times and keep them covered up. It may be your job to actually collect up the instruments and supplies so they're there, to hand them to the physician as needed. Obviously, you are there to make the patient feel good. So you should be professional, but caring and helpful in your attitude. You can provide for their needs, as we said, like I said, physical comfort, encouragement. If it's something that they've got to perform for a little while, what can you do to help them do better at it? Perhaps you would reiterate instructions to the patient. And once the physician tells you exactly what kind of patient education to provide, you will be the one to do that. All right, so this was the physical exam.